Hey, everybody. This is Elaine Belson again. Question was from Mama Foxfire, and she asks, what resources or exercises do you think would be appropriate for someone experiencing imposter syndrome? So, imposter syndrome is very common. In fact, what I find is that most people walk around with these feelings of inadequacy. That is, I'm not good enough, there's something inherently wrong with me, or I'm undeserving. And it's so common that I very rarely come across someone who doesn't feel this way. So it's almost universal. And the reasons for this, I'm not exactly sure whether it's nature or nurture, whether it's just something that we're born with, or whether it comes from growing up in a dysfunctional family where we got this negative messaging that we're undeserving, that we're not good enough, or that there's something inherently wrong with us, or that we chose to compensate for maybe a dysfunctional upbringing by thinking these things about ourselves. Why do people choose to focus on or think this way? I think that it is a coping mechanism for fear of failure and rejection. Now, everyone is afraid of failure and rejection. That is just innate. It's a survival mechanism. But the way people tend to cope with it has a lot to do with how they feel about themselves. And what most people do is they ruminate. That is, they mind read, second guess themselves. They anticipate other people's reactions. They self-criticize. They overanalyze. They compare themselves to others. So they do all these things because underneath it all, they feel like, I can't just be myself. I'm not good enough the way that I am. I'm undeserving. And so therefore, I have to do these things in order to avoid rejection and failure. Even though when we're talking to somebody else, especially somebody we care about, we would never say to them, if you want to avoid rejection or failure, here's what you need to do. You need to mind read. You need to second guess yourself. You need to anticipate other people's reactions. You need to self-criticize, and you need to compare yourself to others. Sounds pretty ridiculous, right? But that's exactly what we tell ourselves. And we tell ourselves that if we don't do those things, then we will surely be rejected or fail because we're undeserving. We're not good enough the way that we are, right? There's something inherently wrong with us, right? So imposter syndrome is really that feelings of inadequacy. And the way that we tend to deal with those feelings of inadequacy is to ruminate. So what do you want to do instead? What is really important to do is to learn how to self-validate. And this is actually easier than you think because it's something that you do for other people all the time. Is you're going to stop using other people as mirrors for a sense of self. Most people walk around like a cup with a hole in it. You constantly need that reassurance and that validation because your cup has a hole in it, right? And so you need to plug up that hole so that you stop needing that all the time. Because for one thing, it can affect how you react to other people's behavior, as well as affect how you feel about yourself. So you learn how to self-validate. And I have two types of self-validation. The first one is what I call be your own best friend. So if you're engaging in ruminating, what you want to do is you want to stop and ask yourself, would I say these same things to somebody else that I care about? And the chances are the answer is no. Why don't you say those things to somebody else? And the answer is, first of all, that's mean. That's not the way you treat people, right? Those are your values. Secondly, you recognize that this is not going to be helpful. It's just going to make the person feel worse. So you have to remember that when you talk to yourself that way, it's exactly the same. You're just making yourself feel worse. It's not helpful. And so it's not going to help you to avoid the things that you're afraid of. So what does work? Think about, if you wouldn't speak to them that way, what would you do instead? Chances are you would ask for more information. What makes you feel that way? Tell me more about the situation. What happened? Where is this coming from? What is it that you're afraid of? And then let's look at what's in your control. What can you do about that? So it's the same when you're talking to yourself. First, you ask yourself, would I say this to somebody else? And if the answer is no, I would not speak to somebody else that way, then you certainly shouldn't be speaking to yourself that way. And then what you do is you ask yourself, what would be a more constructive way of talking to myself if I want to avoid rejection and failure? It would be to problem solve. In other words, what specifically is making me feel this way? And then what's in my control? So that's why I call it being your own best friend. And this applies anytime you catch yourself speaking negatively to yourself. So engaging in imposter syndrome and telling yourself that you're not good enough or you're undeserving, stop and ask yourself, what am I feeling right now? There's an insecurity underneath. There's an anxiety underneath. Chances are the feeling is fear of rejection or failure. And so ask yourself specifically, what is it that I'm afraid will happen? And then what is in my control to avoid it? And that is why you have feelings to begin with. They're there to help you to problem solve. The other type of self-validation is when somebody else is making you feel bad about yourself. And so basically, they say or do something that makes you question yourself. And again, that can lead to imposter syndrome. Maybe I'm not good enough, or maybe I don't deserve this because this person was mad at me or they criticized me in some way. And so what you want to do in this situation is you want to ask yourself, if the situation were reversed, would I talk to this person the way they're talking to me? Would I treat that person the way that they're treating me? Right? And if the answer is no, then that's telling you something. These are your values. This is the way you treat people. And you recognize the way the other person is treating you is not helpful. It's not constructive. And so I call this the opposite of the golden rule. So we know what the golden rule is. It's treat other people the way you want to be treated. So the opposite of the golden rule is you have a right to be treated the way you treat other people. So if somebody is making you feel bad about yourself, then ask yourself, if the situation reversed, would I treat them that way? And if the answer is no, then that tells you that the way that person is treating you has everything to do with them. So in both situations, what you're doing is you're going from relying on other people as mirrors to relying on yourself, your values, and the way that you think and feel. So when you self-validate using be your own best friend and opposite of the golden rule, what you're doing is, instead of basing your sense of self on fear and insecurity, you're basing your sense of self on your values and rational mind. Some other strategies are what I call worst case scenario exercise. What you're doing is you're tuning into the underlying anxiety and asking yourself, what is it that I'm really afraid of? You want to really get down to the underlying and asking yourself, what is in my control to prevent the thing I'm afraid could happen? And then the last thing that you can do in terms of dealing with imposter syndrome is once you've done those other things, you've engaged in self-validation and you've done worst case scenario and you've identified what it is that you're concerned about and what is in your control, then the last thing is to redirect yourself back to the present moment. And I have an example here of my own. There was a time when anytime I heard somebody enter my waiting room, I had an inner office and I had the waiting room, and I would hear people enter my waiting room, I would get this rush of anxiety because I wanted to make sure that I helped them. And so I was experiencing performance anxiety. And so I said to myself, okay, what is it that I'm afraid of? I'm afraid that I'm not going to be able to help this person or that I'm going to disappoint them. And so then I asked myself, if that's the case, then what's in my control to avoid that from happening? And so what I tried to do is I tried to focus on being in the present moment, listening to what my patient was saying, and whatever anxiety I had, I just kept redirecting myself back to the present moment. I was aware that it was there, but what I didn't do is I didn't get sucked into analyzing it or panicking over it and saying, oh my God, I'm feeling anxious. I wish this would go away. I didn't get frustrated with myself about it. Just every time that I started to feel anxious, I would just go back to, okay, let me focus on what this patient is saying and trying to listen to them so that I can help them. Because by listening to them and helping them, that's how I avoid the very thing that I'm afraid of, which is bad performance. And what I found over time is that as I kept doing that, the performance anxiety went away. I was problem-solving oriented, and I did what was in my control. And so I didn't need the anxiety anymore. And remember, we talked about this in the first episode about why we have feelings to begin with. The feelings are there to help us to be proactive, to tell us there's something that we're overlooking, either a need or a threat. And so what this was telling me I was overlooking was that I was concerned about doing a good job. And so the best way for me to ensure that I do a good job is to focus on being present, being in the moment, rather than letting the anxiety pull me out of the moment and worrying about something that could happen or rehashing something that I already did. If you want more content, then you can go to ElaineBelson.com. I have a website there where I have articles on anxiety and self-esteem. And I have other podcasts you can listen to. So again, that's ElaineBelson.com.